I'm Dr. George Ibrahim, and I'm going to explain a little bit about what stress urinary incontinence is, what causes it, and touch on what can be done about it. Urologists specialize in urinary problems in both men and women. As a Duke-trained urologist and associate clinical professor, I've been treating this problem and teaching other doctors to care for it for over 30 years. There are two main types of urinary incontinence: urgent incontinence and stress incontinence. Urgent incontinence occurs when you find yourself all of a sudden getting the desire or urge to urinate and are hoping to find a restroom while you dance on your tippy-toes and cross your legs, and before you get to the facilities you find yourself leaking all over yourself. Stress urinary incontinence, or SUI, happens when you laugh, cough, sneeze, bend over, or exercise. This is due to the abdominal pressure exceeding the sphincter mechanism in women. And while only 50% of women over the age of 35 will admit to this problem, in my experience, the number is actually closer to 90% in women over the age of 50 who've experienced at least one vaginal delivery. Many women don't even complain about SUI because so many of their friends, their mother, their sister, all of them have it too, and therefore they feel that it's just part of growing older. That's nonsense. Do you think men would tolerate leaking every time they coughed or bent over? Heck no. And neither should you. So what causes SUI in women? Well, let me explain. A woman's continence mechanism is based on her urethra being supple. When a woman loses estrogen, as happens in pretty much all women who go through menopause, her tissues become dry and stiff. So I'm going to demonstrate this to you with a whoopee cushion. If I were to blow into a whoopee cushion with my mouth, the moisture from my breath would cause the sides of the tongue of the whoopee cushion to stick together, and this would hold the air in the cushion. Well, the tongue is sort of like the urethra, and the cushion is basically a bladder. Estrogen stimulates the tissues around the urethra to stay moist and supple. Without this absolutely safe, bioidentical, and crucial hormone that women all have had up until the age of menopause, the tissues become dry and stiff, which keep them from sticking together, and thus it's like a wide open tunnel or straw that allows the urine to leak out when pressure is applied to the bladder. So this is a whoopee cushion, and obviously this part is going to simulate the bladder, and the tongue is going to be the urethra. In menopause, as a woman gets older, the tongue becomes more like a straw, which is much more firm. It's not supple, it's not soft, it doesn't stick together the way the urethra would if a woman was having estrogen during her periods. So let me show you what happens to the bladder and continence in a woman whose urethra acts more like a straw than not. That air leaks out. But if the urethra is less like a straw and there's more moisture so that the sides of the urethra can stick together or coapt, the bladder is going to remain continent. And as a woman ages, her tissues become less robust and weaken around the urethra. So both the laser treatments and platelet-rich plasma will help with this problem. Now, stress urinary incontinence is no laughing matter, and puns intended. But today it's treatable in the vast majority of cases without surgery or risk, pain, or downtime. So stop accepting those unexpected leaks as part of your life. And don't let this problem get worse. You deserve the confidence of knowing you're not going to leak all over yourself. Contact our office today. You have nothing to lose except all of those mini pads and liners that you've got in your purse.